Hello, my name is Dr. Joanne Astill-Vacarro, and I am a psychiatrist embedded in the Cancer Center at the FitzPatrick Cancer Center in CVPH Medical Center, and have been there for a number of years working with patients who have a diagnosis of cancer of all kinds. And today's topic is cancer survivorship. So when you receive a diagnosis of cancer, most people feel stressed by that. Some people can feel very scared, very anxious about what the future holds. But I'm here to tell you that a diagnosis today is not what it was maybe 20 years ago. There are many more options, but certainly people face uncertainty and the unknown. And modern methods in oncology have progressed to the point where we are now detecting cancer much earlier. So people are having a diagnosis given to them at a point where their prognosis, their outlook for the future is much more positive. However, cancer does carry with it some issues, and people often wonder, am I going to go into remission? Am I going to have control of this? How is this going to change my life? And there are definitely newer treatments out there which have made some cancers curable, other cancers very controllable. So now we are looking at having really maintenance cancer, people that have cancer over many years and may have to have treatments on and off to control that cancer, but in fact can live alongside that cancer. And that has led to an emerging area of study of cancer survivorship. So what does define someone who is a cancer survivor? Well, as you can imagine, experts don't really agree on that topic. Some will say that you are a cancer survivor from the moment you are diagnosed. Other people will say that someone is a cancer survivor when they have had their treatments and they have finished their acute care. I did just a very quick poll, email poll and verbal poll of some of my colleagues and also some of the patients that I am able to work with in the Cancer Center to see what they really thought about what cancer survivors had in common and what made a cancer survivor. So there were definitely common themes, themes of anxiety, fear of recurrence of cancer was also a very common theme that both patients and providers brought up. But also both groups talked about courage, struggle, and really being a group of people that had stick-with-itness, that have tenacity. So I just want to pull together what survivors in general said about themselves and what oncologists and providers thought about the patients they work with. So survivors really, at the foremost of their thinking was fear of recurrence, effects of treatment, including fatigue, which is a common symptom I see in the Cancer Center, a need for self-advocacy, importance of a support network, and also becoming okay with sort of the new you, maybe someone who looks a bit different because of treatments you've had, maybe mobility issues, maybe issues with how you feel. Taking care of yourself was also another big issue for people who have survived cancer, and also the ability to allow yourself not to feel guilty when perhaps you have had a better outcome than those around you. A zest for life was something that survivors brought up, and struggling sometimes to do the things that you used to do because, again, there are differences in having had cancer and come through that sort of process. Sharing the experience with others. One survivor brought up dating after cancer was a very important issue. Feeling good about yourself and being able to tell those that you get close to that I've had cancer, I'm a cancer survivor. So oncologists and providers, what were their thoughts about it? Well, they really also focused on the patient's fear of recurrence. They also talked about sometimes dealing with pain was an issue. They saw their patients as warriors, people who they could respect because of the self-advocacy and the time they put into conquering their cancer. They saw cancer survivors as often having fatigue, and sometimes cancer survivors as feeling a little rudderless, without a sense of direction once they were through their acute cancer treatment. They also talked about the importance of having supports. So I wanted to look at making the transition from being a cancer patient to being a cancer survivor. So there's survivorship studies have looked at late effects of cancer treatment, and also cancer itself, the things that that does to your body and also your emotional health. There are always psychosocial implications to folks that have had cancer. For instance, maybe you have to have acute disability from work for a while. Perhaps your insurance changes. Perhaps you have to look at different ways of working, part-time rather than full-time, for instance. And there's also a focus in cancer survivorship on health and well-being. You know, maybe you weren't someone who really thought about your own well-being or your own self-care, excuse me, or your own self-care in the past, but now you have to really put yourself as number one. So do cancer survivors have something in common? To come back to that question, yes. Cancer survivors are now living with an experience that they have had that changes them from the person they were in the past. They're now living with a chronic condition. There is this fear of recurrence and fear of the scans, the restaging scans that all cancer survivors go through, which is perfectly normal. There's also a new focus, as I was mentioning before, on priorities. What's important in your life now? How do you want to focus your energy at this point in your life? Accepting the new you, physical form, pain. Maybe you can't eat certain things. Maybe your sense of taste has changed. Maybe your sense of smell has changed, and you're sensitive now to things that used to smell pleasant to you and now do not. Maybe you have a decreased exercise tolerance and you were someone that always hit the gym every day or every other day. And also dealing with others and their approach to you as being someone that's had cancer as an experience. Survivor guilt is something that came up in the provider poll, not so much in the cancer survivors. It's not so much something I found in the literature, but it's definitely something I've seen in my practice over the years. Sometimes people that have survived cancer and are living with cancer or living cancer-free feel guilty about surviving when those perhaps that they met in the waiting room or that they have met in group situations did not survive. I think it's important to note that that's a very normal thing to feel, and we certainly have ways to approach that. Working on self-esteem, working on the fact that everyone has a different outcome. Cognitive behavioral interventions are also important there to reframe people's thinking. So that leads into interventions for survivorship. Support from nursing and from mental health professionals in the oncology center are very important. Not all community cancer centers are able to have mental health provisions. Most academic centers do, but it's very important to have that mental health component. Information about diet. We have a great dietitian in our cancer center here, and more the research has looked at any chronic illness, including cancer, and diet being very important as a way to stay healthy and to feel as good as you can feel. Sharing information about self-care, sharing information about having realistic expectations of life after cancer, and also efforts to increase this, this term resilience, which you've probably heard just out and about. It's a term that's often sort of out there commonly, and it really means being able to be flexible, being able to deal with things as they come, and being able to find ways to cope with stress. And also decreasing cancer-related anxiety. Addressing insomnia, pain, fatigue, also very important. We can address that with medications, with cognitive behavioral interventions, sometimes with changes in environment. And also looking at increasing autonomy and choices. sometimes when people are going through acute cancer treatment, there is often a sense of, I don't really have control. Okay, the doctor's telling me this chemo needs to be given on this day. This is the dose. I need to have this port put in. I need to show up. I need to take this medication to help with my nausea. There's often a feeling of helplessness and a sense of loss of autonomy. And it's important to move that autonomy back from providers to the survivors themselves. I just want to say something extra about diet and exercise. There's been a lot more study, a lot more published about many chronic illnesses, including cancer survivorship, and the need to focus more on plant-based foods. Also decreasing saturated fat, salt intake. So the things that we're talking about for general health, the things that most dietitians are now recommending, seem to be very helpful for cancer survivors in feeling the best they can feel. What does that mean? It means increasing fruits and vegetables, increasing legumes, those weird things like lentils and beans in your diet can be very helpful. And also there's been a body of literature now looking at regular, moderate exercise. I don't see anybody saying, okay, go out and train for a marathon and run a marathon. If you can, if you want to, that's great. But really moderate exercise 4 or 5 times a week. Walking is fine, 30 minutes at a time. And maybe you can't start off there, but you can build up to that kind of level of exercise. What do we mean by self-care? We mean getting enough rest, dealing with insomnia, finding ways to have enough sleep to feel refreshed when you wake. Stress relieving activities. So maybe that's exercise, maybe that's listening to music, maybe that's playing with your grandkids, maybe that's lighting a nice candle that smells good. Meditation and yoga have been looked at quite a bit in the literature. I often talk to people I see about doing chair yoga, because when I mention yoga, they say, oh, no. There's no way I'm going to get my left foot around my right ear. And I say, no, you don't have to do that. Chair yoga, you're seated, you're moving your upper body, you're focusing on breathing and on visual aspects of meditation, and you don't need to be able to do any kind of pretzel stuff. And seeking professional help if sadness that you feel or anxiety is, continuing for a while. And the main thing is if it's interfering with your life, that's a reason to seek some sort of professional help. So preparedness for survivorship. What the literature has looked at is addressing reality issues like finance, work, disability, and often social workers embedded in cancer centers can help you with that. We have a great social worker here, Alex, who will be happy to help with those kinds of issues. Mobilizing support systems, looking at something called mutuality. Mutuality means having people supportive around you that can help you and be there for you and just get you through things. And if that's not something you have in your life, then we build that in. We have you meet with a counselor. We have you meet with peers. We get you into survivorship groups, things like that. And beginning to address very early on in treatment what happens after that initial flurry of investigations, treatment. What happens after you ring the bell in radiation because you're finished? What happens then? So defining survivorship, very important. Addressing the idea of survivorship very, very early on in cancer treatment. Some people would say addressing it at the first visit. Others would say a little later, but not waiting until months after your treatments are done. And measuring physical and emotional factors that can create a burden. Measuring pain, fatigue, measuring that fear of recurrence, measuring a change in focus or memory. All those things are really important. So thank you for listening. And I hope that's given you a little sort of window on cancer survivorship, and hopefully it will open up a dialogue. Thank you very much.